Hi everybody, welcome to the video. In this video, we'll be learning about cognitive behavioral therapy and how it can be used to address the phobias we face in our everyday lives. Additionally, we'll get a chance to just kind of learn about CBT in general, a little bit more about our phobias, and what they mean, what they make us feel, and overall how to deal with them. First, I guess we should figure out what are phobias. According to the dictionary, a phobia is an overwhelming fear of an object, place, situation, feeling, or even an animal. To deal with a lot of these pressures, a lot of people lean on the strengths of cognitive behavioral therapy, otherwise known as CBT. This can be a really effective method when we're trying to deal with things such as unhelpful thoughts. CBT displays that when we have feelings, our feelings connect to our thoughts, and then our thoughts, what we think, ultimately leads to our behavior. This creates an ultimate cycle. But the good news is, what CBT points out, is by changing how we feel about certain things, we can change our thinking about these things, and ultimately, we can change our behavior towards these things and patterns. The foundation of CBT is focused in cognitive restructuring. Cognitive restructuring is a therapeutic approach that helps people identify, challenge, and replace ideas. First, when you identify the problem or the thought pattern that's not really helping you in certain aspects of life. Secondly, you begin and you aim to challenge the thought process and question why you may feel this way and dig in deep in that thought pattern. Lastly, after challenging the idea, you find a healthier alternative and you replace that idea with a more balanced and realistic option. And these are the core foundations of cognitive restructuring. When trying to address one's personal phobias or fears, CBT can be really great at that. One of the methods they use for that is something called exposure therapy. And here's 4 really awesome ways that exposure therapy can be really good for you. First, it helps people build habits that help them decrease fear over time. Second, it leads to extinction. This means that it weakens the learned associations between the fears and the bad outcomes. Third, it leads to self-efficiency. This means that it shows a person's ability and capability to conquer their own fears. Lastly, it leads to emotional processing. Emotional processing gives the person the ability to attach new beliefs to previous fears. Now, in essence, when we're trying to understand phobia exposure, the main thing that we gotta understand is that it ultimately involves facing your fears. But before we get into finding out how do we actually face our fears, first I think it's important we figure out who do we even talk to when we want to do this CBT thing. Well, when you decide that you want to do exposure therapy through CBT, first you have to find a mental health professional who specializes in exposure therapy. Once you find a mental health expert to focus on your exposure therapy, there's a couple of questions you may want to think about. Like, how long have they been doing exposure therapy? How often do they do it and who do they work with? What type of treatments do they offer? Is their pricing covered by your insurance? And ultimately, do you feel comfortable after meeting them? After you go through these steps and start exposure therapy, it's important to understand exposure therapy is really cool because the more you embrace it, the more impactful it becomes in your everyday life. Prolonged therapy exposure in many respects can ultimately lead to a more happy and fulfilling life in the ways we address our fears and phobias. Just as with anything else, there can be pros and cons. Some of the cons associated with this might be that maybe you're not ready to face your fears and confront those triggers head on. Maybe you're experiencing some trauma that's kind of related to your fears. Or maybe you want to discuss some of your challenges more in a flexible environment. Alternatively, some of the pros can be that you get a fast-paced intervention. Maybe you want a goal-oriented approach. Or maybe you just want to learn new and empowering skills. So now that we talked a little bit about exposure therapy, how about we do an example so we could really understand what exposure therapy is? I say for this example that we use a phobia and a fear that a lot of people have. So for this one, we'll use the example of the fear of spiders. To start this process, we must first understand that it breaks down into 5 essential components. First, it breaks down into the educational aspects, making sure that the individual understands what exposure therapy is. Secondly, we focus on cognitive restructuring, which means changing how we look at spiders. This may come in the form of understanding that the majority of spiders are not poisonous and actually fear us more than we fear them. So by changing that thought process, it helps in understanding that we're more of the threat to spiders than they are to us. That's an example of cognitive restructuring. Thirdly, we focus on gradual progression to grow in our understanding of these issues against spiders and our fears and phobias to hopefully understand them a little bit better as time progresses. The fourth stage, we begin to lean more on the therapist and their guidance as we prepare for the actual exposure. And lastly, in the fifth stage, we start the actual application to begin the actual exposure therapy. When it comes time to actually choose to do the exposure, there are actually multiple ways to do an exposure therapy, specifically when dealing with spiders. First, you can do a vivo exposure, or aka a real life exposure. This would be maybe going out and playing with a pet tarantula at your local pet store or with one of your friends. Second would be an imaginational based exposure. This could come from just thinking about it purely in your mind of touching spiders, or even playing a cool spider based video game even. Thirdly, there's interoceptive therapy exposure, which is aimed to help simulate the panics and the anxieties associated with those exposures to help the client get through those with the therapist. Lastly, as technology has grown, we've also seen the introduction of virtual reality exposure therapy. So as you prolong your exposure to your phobias and fears, you will begin to see decreases in your phobias and fears, and slowly but surely, they will eventually be all but erased. And in all, that is how exposure therapy works through CBT. Thank you for your time. We appreciate you. Be safe.